Hi there. Right now I'm going to explain our anesthesia machine to you. We have kind of an unusual setup here at All Creatures Animal Hospital. We actually have a generator that takes room air and converts it into oxygen for our patients. On the back of it, we also have a tank. This is for emergency when we have power outages. I did check this. The PSI on this tank is at 1500 PSI, so we're good on that. But we do not use this during our surgery, so I have turned this off. We have a little switch here between auxiliary and main. Main is using the oxygen generator, auxiliary is using the tank. So I have checked it, I have put it back to main. So what happens is we have two setups here. How this works is that either cord is green. It takes either the oxygen from the tank or from the generator. It brings it up here to the flow meter. From the flow meter, the anesthetic gas, which is isoflurane, comes. It joins with that. We have inhaling and exhaling, which is the tubes. It comes through the tubes, which hooks up to the patient through the Y, and it delivers the anesthetic to the patient. As far as the soda line, well, then it exhales. It comes back down from our center here. It follows the cord and it goes into the FR canister, which catches the CO2 from the patient. So I have checked the oxygen. We're at 1500 PSI. Our soda line has been changed, and it was changed on Friday. It was actually changed by me, so it's good. Our isoflurane is right at half, so it is full. So we are doing a surgery on it. We're doing a neuter on a 30-pound canine. So I have chosen the 2-liter bag for that procedure. So right now I'm going to pressure test it and make sure everything is great. I'm just going to turn our oxygen generator on. I'm going to check the flow rate. Our flow meter is working. And we also have it set up here also. Our pop-off valve is a push button. It is not a turn. So I'm going to hold off on the tube. I'm going to come over here. Squeeze the bag. Hold it about 5 seconds. It is holding at 20. H2O. And we're going to open this and make sure this is up. So this is our anesthetic machine. I just want to test that our isoflurane handle does flow freely. And everything checks out on this. So this is how we check our anesthetic machine. Hi there. Right now I'm going to show you how we open up a package of sterile gloves for our surgeons. I have chosen the proper size. It is a 7.5 for Dr. Rich today. So I'm just going to open this up. Take them out. I'm just going to dispose of that. So I'm going to just unfold this for him. I have our Mayo stand. I'm going to open it up right and left for him. So I'm just going to unfold the paper here so it opens freely. And then there are 2 flaps right here for me to put my hands under and open, so that way my hands are not touching or anywhere near the sterile gloves. So at this point, I just grab the flaps, open it up flat for him, and now he can come in and glove. And then I'm just going to back away from the table and move the other way. This is how we open sterile gloves. Hi, this is Diane, and I'm going to be surgically assisting Dr. Carey today on a hernia repair. This is our operating room. We want to make sure that it has been totally cleaned. The table has been disinfected. The floors have been scrubbed. This takes place prior to every surgery. We try to keep it as clutter-free as we possibly can to avoid any dust in here. I did go ahead and choose the pack that we're going to be using today. The indicator tape has shown me that it has been sterilized. It was done
on Monday, and the initials of the person that did it are on here. So I'm just going to go ahead and that open. Now what I'm going to do is I'm going to go ahead and open it. I'm going to open 3 sides and leave the last side for us when we come in. So I'm going to go ahead and open this flap to the right or left, and then the other flap. And then I'm going to leave this last one here for me to pull open once I am scrubbed and gloved in and gowned up and prior to going to surgery once the patient's up. This is the pack that I previously opened. Now that she's here, I'm going to go ahead and open the last flap towards the patient. I'm going to open 1, 2, 3, and the last flap towards the patient. Got this moved up closer. Okay. Now I'm just going to organize things in a way to help assist Dr. Carey. I'm going to go ahead and handle towel clamps. You want to make sure the ratchets are opened. Oh, she wants to cut the, there you go, scissors. You want to make sure you hand the blade away so you don't stab your doctor. Make sure you grab the suture about halfway to 3/4 down.
Just the momentum here before I moisten.
You want to make sure you keep tissue moist. So I'm just going to go ahead and moisten things down a little bit.
You want to hold on to her oars. So this one's done with this tie up. We get along really well.
Yeah.
With Molly, you said screw her. Alright, will you cut that band with the knot? I'm like, dude, when you're at someone's house and they have something, like, you guys can play with the dolls together. You just don't want to play with dolls. Here, I'll buy you a damn doll. Like, I don't care that you're playing with dolls. I care that they were their dolls and they wanted them back and you were not willing. Well, I was just playing. But a 6-year-old does not play that way. Like, they were upset because they wanted their stuff back.